Thanks, Premier, and good morning. So for today's locally acquired cases, and there are 15, 4 are linked to Al Taqwa College, 1's a student, and 3 others are household contacts in different households. 2 cases are linked to the City of Hobsons Bay outbreak in Newport. 2 are household contacts, again from 2 different households, and these are from contact with 2 different players who attended the football match that was involved in that cluster. 1 case today is linked to Carolyn Springs Square Shopping Centre, a household contact of a staff member in the shopping centre. So that's 7 cases. Other cases today, 1's a household contact of an existing case in the City of Melbourne outbreak. Yesterday we had a case living in West Brunswick who'd visited the Flemington and Parkville areas during his period of infection. We have 1 household contact of this case who's turned positive. We also reported 3 cases from 2 separate households in Glenroy yesterday, and today we can report 2 related cases at Glenroy West Primary School, 1 student and 1 household contact. In addition, there's 1 household contact of one of yesterday's Glenroy cases who's a student at another primary school, and we'll provide details of that when the school's been contacted this afternoon. So that's 12 cases. And then there are these 3 so far unlinked cases. 1 case lives in Wyndham Vale and works as a delivery truck driver. That's a exclusively state-based truck driver, not an interstate driver. There are a number of exposure sites in Werribee that have been generated, so please check the website for those details. Another case lives in Roxburgh Park and works in Bundoora. There is a link to one of the school communities that's being investigated now, so we'll be able to hopefully link that and provide updates tomorrow. And 1 case lives in Middle Park. This is still under investigation. A number of exposure sites generated across Middle Park, South Melbourne and surrounding areas. So that's 15 cases in total today. And those mystery cases, as the Premier said, are a particular concern. These are individuals who don't know that they were infectious at a time. They've developed symptoms, they've gotten tested and done the right thing. They're now isolating and their primary close contacts are being followed up. But they've been out in the community within the restrictions that are imposed in the lockdown, but still shopping for food, going out for essential reasons. So those exposure sites are quite numerable because that individual wasn't already identified as a primary close contact. That's the challenge of mystery cases. That's why we need to get on top of them as much as possible. The thing that will identify those links as early as possible are people getting tested with the earliest of symptoms and the mildest of symptoms. So we're looking at all possible linkages, schools, local sites visited in that acquisition period of the 14 days before symptom onset, and any workplace connections for those attending on-site work. We've had continued high demand for testing in Melton, which is fantastic. A new Melton drive-through site is operating from 9 a.m. to 8 p.m. today, and then 8 a.m. to 8 p.m. on the weekend. So please access that. That's at Melton Football and Netball Club in Toolern Vale. We've also been advised of 4 new unexpected wastewater detections in Metro Melbourne and in regional Victoria. That includes Lakes Entrance, Camberwell Balwyn, which has kind of pinged on and off over recent days, and 2 catchments in the western suburbs, including Tarneit, Truganina and Williams Landing. So, as we always say, any symptoms, please get tested, but in particular in these catchments, bear in mind there could well be a case in these catchments. It could be you. You need to get tested if you have any symptoms at all. On vaccination, as the Premier has thankfully repeated, the best vaccine to get is the one that you can get now. We've seen a lot of young Victorians turn out in their thousands with AstraZeneca available through our state-based hubs, 18 to 39-year-olds. That's fantastic. Monday to Thursday last week saw more than 18,000 AZ doses given at state-run sites. This week over the same 4 days, 31,000 AZ doses given. So a really significant uptick there. We do need Victorians of all ages to look at that stepping up and kind of reflect the enthusiasm for people coming forward for vaccines, especially as the threat in Australia is probably greater than at any point since March of last year. A huge thank you to the doctors, the nurses, nurse immunisers, pharmacists and other immunisers across Victoria who've helped more than 2.5 million people get their vaccine, their first dose. Doctors and pharmacists play a key role in delivering vaccines in Victoria. More than 1.9 have been delivered through doctors, respiratory clinics and community health services. That includes more than 1.5 million doses of AstraZeneca, more than 390,000 doses of Pfizer vaccine. So we absolutely encourage people to speak to a doctor, pharmacist or a senior and experienced immuniser at our state-run clinics if they have any questions, any concerns about the COVID-19 vaccine. The AstraZeneca advice has changed over time. Look at it, consider it for your particular circumstances and make a judgment. No one's being coerced, no one's being unreasonably pushed here. We've opened up the operational availability of vaccines, but that decision-making is with you and a trusted health professional to advise. The evidence is clear, however. Vaccinations will decrease your chance of getting serious illness, getting hospitalised or dying. So your vaccination will make a difference for you, for those around you, for the entire Victorian community. The more people vaccinated, the better protected we will all be.